Oh, I got to stand up here so I can see my slides, right? Hi, my name is Sandra Beecher. I work for Gateway Foundation, and is this gonna, oh, there it is. Just to tell you a little bit about myself, I've been doing this, 30 or 40 years throughout my career, working in substance use and mental health. I started out at Chestnut, thought I was gonna retire from there, but I didn't, of course, so I've been halfway around the world and back since then. But what I want to open up with is really how difficult is it to talk about substance use or mental health? What's the stigma? Why is this thing not? Maybe my cup's in the way. Sorry. There. How difficult? How difficult is it to talk about alcohol or anxiety or depression or gambling?
It's a sign of weakness, maybe.
Okay. Anybody else?
I feel it's gotten better. The mental health stigma's gotten better or less since COVID. I think people are more accepting of it than COVID, and it's not such a taboo topic anymore.
Right. Well, and the more and more we talk about it, and the more that we understand the language around that, because I know I've done a lot of conferences both locally and nationally, and somebody will be standing there, or even after hours, somebody will be drinking a beer and they'll ask me, what do you do? Well, I said, I'm not going to tell you until after we talk about what you do and build that relationship, because otherwise they're like, oh, I got to move on. Like I've judged them because they're drinking a beer. But there's also that language around drinking responsible, gambling responsible, right? Is it okay to drink? Yeah, but you don't drink and get in a car and get a DUI and harm other people, right? So just, how many in here really know what Gateway does? Iffy. We've been around for over 55 years, honestly, and it's all working with substance use and mental health. We are throughout all of the state of Illinois, which we'll kind of talk about that throughout the presentation. And really, how do we help? We have a new facility that's right down the street here next to PNC Bank, Gateway Foundation. We have opened up in March. I have been in this community all my life. Since I was a kid, I went to school at University High School. And throughout all the treatment centers that I've worked at, I really wanted them to do an outpatient for the community to get here and talk about any kind of substance use, talk about gambling. We've started up a gambling program that it's kind of my baby, just so that to help people that are struggling with that destroys their life, even just an education around that. So just down the street, we have intensive outpatient where people can come in after work or before work, evenings or daytime, to where they can get services and get help for either counseling, groups, individual. So our clinical model, we'll talk about that and how we partner with other people in the community. So we already kind of talked about some barriers and what are the individual needs in this community. Do you think substance use, mental health, gambling, all of those, even process addiction, gaming, sex, food, shopping, spending? I mean, we've all struggled and went through this just devastating trauma. We all went through it together. And after COVID, everybody is realizing, what is this that I am dealing with? It might just be generalized anxiety. I feel like we're all on the fast train trying to make up for 2 years that we lost, which is really hard. It's difficult. And then we believe that it's a disease model. A lot of people don't believe this. They think that if I come to you, why don't you just stop? Why don't you just quit gambling? Why don't you just quit drinking? It really is a disease. It hijacks your brain. Basically, if you have other criteria as far as like the genetic piece, maybe you have a grandfather or a long descendant of your family that had struggled with maybe alcohol. We'll pick on alcohol, because I don't want to talk about the whole opiates and prescription pills, which we can dive into that. But if you have that genetic piece, you're prone to having a problem with substance use disorder. What about accessibility? How accessible is alcohol? Even when we went through the pandemic, they were delivering it. You can drink, shut off your camera, and have your alcohol delivered to you. even in the casinos or the gambling slot machines, now at the casinos, beer is expensive. But if you come in and gamble, they'll bring your beer to you for free. So why not? Kind of goes hand in hand. So it's just very accessible. What about acceptable? Is it okay? Sure. It's okay to drink, right? Is it okay to gamble? I mean, now it's, women are having a girls' weekend out and going to Vegas. They go together, so it's acceptable. And then when you put that genetic piece in there, and everyone knows, I hope they know, anything that you do day in, day out, 60 to 90 days, what's going to happen?
It's a habit.
It's a habit. Can you just stop it once it hijacks your brain? And it honestly helps you, they think, helps you with your anxiety, helps you with your depression. Alcohol is what? A stimulant or a depression? Depressant. So it just exacerbates it. So again, we've been here over 55 years. We have 17 locations throughout of Illinois. We also do specialty programs. So we have Recovery Advantage, because a lot of people have worked with veterans that alcohol is their issue. And if I say, okay, come to us, we'll get you healthy, we'll put you in a residential program. And if I put them with other people that maybe are addicted to prescription pills or heroin, or they've been in trouble with the law, they feel totally out of place. So we developed a program where it's alcohol use only. It's called the Recovery Advantage, where that's all that's there is people struggling with alcohol, so that it can make them feel a little more, where they can relate. We also have Her Story, which is a women's program down in Carbondale. They can stay there for a longer, extended period of time, longer than 28 days, to deal with their trauma, and that's women's only. Triumph program is really built, it's out of Springfield, where people can, if you're working, the biggest thing that we found, if people want to get healthy, they can't quit working. I mean, how many in here can take off 25, 30 days? I can't even take a week off. So we have developed a program where they can come there and work while they're there, or students, not to miss school or anything. We try to meet them where they're at so that they can get healthy while they're there. And then our gambling program is all virtual. So, just to try to help them set limits and what's really going on. And as you can see over there, I don't know, you can barely see it. It's all of our locations. We just opened the one in Bloomington in March, and then we're opening up another one in Peoria, doing the same thing. Not yet. 25th. We had a ribbon cutting. Thank you. We had a ribbon cutting, and then we're opening the 25th, and then we'll start. But yeah, it's okay. We still take the phone calls. We did have the party, and then we couldn't open because of our licensure. We do provide primary mental health as well. It's new to us, not new in our world, but it's new to try to serve those that do primary mental health. So if you have anxiety or depression, you can call. We can set you up with individual counseling to deal with that. And that's all funding. If uninsured, Medicaid, MCOs, Medicare, all funding. So it's not, oh, I'm sorry, we can't take your insurance. We can't help you. And if there's an insurance that we don't take, or if we can't help you, we'll send you to someone else as a referral. That's what we do in communities, right? Is to not say, sorry, we can't help you, but this is why we do this. So that, because I know somebody that can help you. I know somebody that can help you. I know somebody, and we can refer them to you guys. Levels of care, we've been talking about this through the whole thing except for recovery home. And do you understand what residential is as to where you come and live with us? Intensive outpatient is where you stay in your own home, you work or whatever you've got going on in your life, and then you come in for groups with us to where we can get you healthy while you're home. And then outpatient is just a lower level, like maybe 1 day a week or 2 days a week. Recovery home is more where you can come and we will get you healthy, and say you need a longer extended care to get that 60 to 90 days to help you with your habit. Because a lot of times you'll discharge people, they'll go back to their home environment, and the rule of thumb is people, places, and things. You go right back to your environment, what happens? You start hanging out with the same people and you start engaging right back into what you did before you got help, to get healthy. So we have a recovery home as well. Oops. This is just a lot of our staff and our sites that we do a lot of different things throughout our treatment. We have psychiatrists, we have doctors, we have nursings, we have therapists. They're all licensed therapists so that we can totally holistically take care of someone if they need a medication. A lot of times we'll want them stable enough to come to us so that we can help tweak their medication, because a lot of times people will go to their psychiatrist or they'll go to the doctor, I'm dealing with depression, and they'll give them a low dose of something to help with that, and then it's not working, so they just keep tweaking it. And then all of a sudden you have a lot of different diagnoses and then the medication's not working at all. So just to try to help with that. We do a lot of different treatment modalities to help meet the client where they're at, which I won't go into a lot of that. And then this is kind of our certifications and, Blue Cross and Blue Shield and who all has our dual diagnosis and all the insurances that is helping us. This is our clinical model. We also do safety sensitive seeking. If anybody has, some suicide history, to help them with that. Any kind of staying in the now to try to help them people come to us that are so overwhelmed because things have happened in their life. Instead of digging into their past and looking at the future, we always try to get them in the present. Because, I always say, you can't change the past, right? It's gone. It's like a canceled check. You just file it away and you learn from it. And tomorrow, why worry about tomorrow? Don't you have enough to worry about today? Absolutely. Take care of what you have today. Tomorrow will come. So it's just try to get them to not be so overwhelmed. 12-step philosophy, motivational interviewing to try to help them, move them from where they're at to getting healthy and wellness. And this is just, our biggest thing is our referrals really come from our clients or patients, because they're the ones that the word of mouth is our biggest referral source. We don't want people coming out of treatment going, yeah, they ruined my life, or, so this is our percentage, overall rating of care. That's both outpatient and inpatient, which I thought looked pretty good. I mean, you'll have a few. And this is our Springfield location that does all of our residential. They also do all levels of care. But, again, we have little outpatients that we can take care of them. And if they need something of a higher level of care, we can do that as well. And this is just a few pictures, 24/7 medical, co-ed, we have men and women there. Can't really see that. That's our professionals program. And it used to be back in the day where when you did residential treatment, a lot of people had stigma where it was a hospital-based program. I'm not coming in there because it'll be a hospital. That's not true anymore. We try to meet them where they're at. And if they don't need to be in a hospital, we'll put them where we have high top tables. We have pool tables. We have gaming systems. We have comfortable seating, because we want it to be welcoming. We want it to be home, because it's not fun. Nobody wants to go to treatment to get their life together. So we try to deal with that and help them as they come in to feel like home, to where, they'll feel comfortable and trust. This is our Jacksonville facility where you can stay there a long time, 6 to 9 months if you need it. And that's, it's in Jacksonville. And just a few pictures of, we have a male residential, and it's all a male residential program. This is our dining hall. All of our facilities for residential, we have our own chefs that cook our own food. That was the biggest thing about treatment was, we ask you, what was the best thing that while you were here, what's not good? And we try to take all those satisfaction rates and change it. And one of the biggest things is food, And then this is our, I don't know that warp that on the other side, but this is our Bloomington Training Center. So just down there, anybody that wants to use our training center, it hold about 50 to 65 people. And we have all the whiteboards and all of that. So anybody in the community that needs to do a presentation, there's no charge for doing that. You just got to call me and let me know when you want to use it, and we'll get you scheduled. So it has everything that you need. We can either do we can even do virtual and in person, so that everybody can see everyone. And this is all my information to get a hold of me. One of the things that I do is my strength is advocating for families and individuals and getting them where they need to go and what they need. Even the simplest things. Have you been to the doctor today to get blood work? Maybe they just, haven't been to a doctor. No, I haven't been to the doctor for 25 years. So it's keeping it simple, building that trust with them, and helping them find the resources in our community that they need to get the help. That's it.
Awesome. Thank you.